Hello everyone, my name is Rafael Pinto and today I'll be presenting the grant proposal for Group 12 titled The Use of Lactic Acid Bacillus rhamnosus GG during winter as a preventive measure of upper respiratory tract infections in healthy preschool children. Just for a brief introduction, to mention that URTIs affect billions of children worldwide, with over 17 billion cases reported in 2019. And this has a very big impact on health, increasing the burden on families and healthcare personnel. URTIs are also even more prevalent during winter, which is why there's a need to develop preventative measures, and probiotics have emerged as a cool alternative to prevent these infections. However, their influence is still unclear. We believe that if effective, this intervention could help reduce the burden on health services and also decrease children's morbidity. For a research question, we want to test whether the administration of this probiotic for 12 weeks during winter could help reduce the occurrence of URTIs in healthy Brazilian children aged 2 to 5 years of age. So for a study design, we aim to recruit the patients, randomize them into either of two groups, the probiotic or placebo group, and then assign them and evaluate them over time. Our participants will be recruited from daycare centers and preschools in Porto Alegre, Brazil. They will receive either the probiotic or the placebo once daily during the 12 weeks of the study. The data will be collected using a daily electronic questionnaire, which will be a phone app. And then, if a threshold of URTI symptoms is reached in this questionnaire, then we will schedule an appointment with a trial GP who will be the one in charge of making the diagnosis of URTI. And all children, parents, and study personnel will be blinded to treatment allocation. We will use descriptive statistics to describe the group's characteristics. And also for our outcomes, the primary outcome will be the number of children with URTIs, and this will be tested using either a chi-square or Fisher's exact test. And for our secondary outcomes, we'll have the number of days absent from school with antibiotic use and illness duration, and also the number of URTIs per child. All of these will be tested using either a t-test or a Wilcoxon-Ransom test, and the number of children with hospitalizations, which will be tested using either a chi-square or Fisher's exact test. And all of this analysis will be performed using Stata statistical software. For our discussion, we can mention that previous trials have shown conflicting results due to high heterogeneity and study limitations, and also there's a striking lack of evidence of the effects of probiotics in South American and Brazilian population. Among the strengths of a study, we have the study design, the blinding of the participants, the randomization process, and the fact that we're addressing a public health problem, but also some limitations such as adherence to medication, the exclusion of patients with chronic diseases, and reliance on self-reported data. We believe that if our study can help provide important insights into the use of LGG as a preventative measure for URTIs in preschool children. So yeah, thank you for the time.